Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Mullarian agenesis. Mullarian agenesis. The genotype of Mullarian agenesis is 46XX. In Mullarian agenesis, the gonads are predominantly ovaries, which are normal. The ovaries develop from genital ridge, so it is completely normal. Ovulation is also normal. The estrogen is normal. The secondary sexual characters are normal. Luteinizing hormone and follicle stimulating hormone is normal. Then what is the defect in Mullarian agenesis? The defect is mainly the absence of both the Mullarian ducts. Because of the absence of both the Mullarian ducts, fallopian tube, uterus, cervix, upper vagina are completely absent. So, complaints of primary amenorrhea. Primary amenorrhea, there can be difficulties like coital difficulties because of short vagina. Structures present in Mullarian agenesis are both the ovaries are present along with lower part of vagina. Rarely, distal part of fallopian tube is also present. Females may also have renal anomalies. The most common renal anomaly in Mullarian agenesis is renal agenesis. The second most common cause is presence of horseshoe kidney may be seen. The skeletal anomalies include presence of hemivertebrae. So for all these, you should always do in vitro fertilization. Then the second.
For all these, we should do intravenous pyelogram. To detect the renal agenesis or horseshoe kidney, we should do intravenous pyelogram.
Disorder is Mayer-Rokitansky-Kushner-Hauser syndrome. Mayer-Rokitansky-Kushner-Hauser syndrome. Here you will see the following abnormalities. There will be Mullarian agenesis, skeletal anomalies, and renal anomalies are seen in Mayer-Rokitansky-Kushner-Hauser syndrome. The diagnosis of this is karyotyping along with in vitro fertilization can be done and skeletal X-ray. Manage
Karyotyping along with intravenous pyelogram and we can also do skeletal X-ray.
Management of Mullarian agenesis include the patient cannot initiate menstruation in a female, the uterus is absent, coital difficulties will be seen in the future, and if there is coital difficulties, then we do a vaginoplasty is done. The best method for coital, the best time for vaginoplasty. So in order to prevent coital difficulties, we do vaginoplasty, and the best time to do vaginoplasty is just before or after marriage. The best method for doing vaginoplasty is McIndoe's vaginoplasty, or laparoscopic method for doing vaginoplasty is V-Chetty technique. The females cannot become pregnant, but they can have their own biological child by in vitro fertilization with surrogacy. Differential diagnosis of Mullarian agenesis is androgen insensitivity syndrome.
In Mullarian agenesis, the Mullarian ducts are absent. So as a result, from the Mullarian ducts, the fallopian tube, uterus and the upper cervix and upper 4/5 of the vagina will develop. So all of these are not developed due to the absence of Mullarian duct. Then the ovaries are developed from the genital ovaries are developed from the genital ridge. So the ovaries are normally developed, whereas the lower 1/5 of the vagina is developed from the sino-vaginal bulb. So the lower 1/5 of the vagina is also normally developed. Then because ovaries are normally developed, there is normal estrogen is present and normal progesterone is present, and because there is normal estrogen and normal progesterone and pituitary is also normal, so follicle stimulating hormone, luteinizing hormone is normal, and hypothalamus is also normal. So because hypothalamus is also normal, it produces normal amounts of gonadotropin releasing hormone also. And here the androgens are also normal. So androgens are normal. So secondary, actually estrogen is normal. So the secondary sexual characters are also normal in these patients. So because here the ovum can be produced because ovary is present, but the problem is in the tract. So because of the absence of this fallopian tube, uterus and cervix, there is no menstruation. Thus the patient presents with primary amenorrhea. And the Mullarian duct is in a way related to the renal development. So there is renal agenesis is present with horseshoe kidney and hemivertebrae.
Thank you and thank you for watching.